Question 1. The performance metrics show a slight delay in initiating emergency protocols during simulated medical emergencies, specifically concerning cardiac events. In a real-life scenario where a patient suddenly collapses, becomes unresponsive, and exhibits signs of a potential cardiac event, what is the most appropriate immediate action for a Certified Dental Assistant trademark, CDA, to take? Option A. Attempt to administer over-the-counter antacids, assuming the patient is experiencing indigestion. Option B. Immediately call for emergency medical services (EMS) and then begin basic life support measures as trained. Option C. Wait for the dentist to observe the patient and determine the next steps before taking any action. Option D. Administer a prescribed emergency medication from the office emergency kit without consulting the dentist or EMS. The correct answer is B. Immediately call for emergency medical services (EMS) and then begin basic life support measures as trained. Explanation. Scenario analysis. This scenario is professionally challenging because a dental assistant must act decisively and effectively in a high-stress, life-threatening situation while adhering to established protocols and maintaining patient safety. The rapid onset of a medical emergency requires immediate recognition, appropriate intervention, and clear communication, all within the scope of practice for a Certified Dental Assistant trademark, CDA. Failure to act appropriately can have severe consequences for the patient and legal ramifications for the dental professional and practice. Correct approach analysis. The correct approach prioritizes immediate patient assessment and activation of emergency protocols. This aligns with the CDA's responsibility to recognize and respond to medical emergencies, as outlined by dental, assisting regulatory bodies and best practices. Promptly calling for emergency medical services, EMS, ensures that advanced medical care is en route, while simultaneously initiating basic life support measures within the assistant's training and scope of practice, demonstrates competence and adherence to emergency preparedness guidelines. This proactive and protocol-driven response is the cornerstone of responsible patient care during a crisis. Incorrect approaches analysis. One incorrect approach involves delaying the call to EMS to first attempt to manage the situation independently. This is a critical failure because it wastes valuable time during a medical emergency where minutes can be the difference between life and death. It also exceeds the scope of practice for a dental assistant to manage a potentially serious cardiac event without immediate advanced medical support. This approach demonstrates a lack of understanding of emergency response priorities and regulatory expectations for immediate activation of external emergency services. Another incorrect approach is to rely solely on the dentist to initiate the emergency response. The dentist is the primary provider. The dental assistant has a crucial role in recognizing the emergency and initiating the first steps of the emergency protocol, which includes calling for help. Delegating the entire responsibility of initiating the emergency response to the dentist, especially when the assistant is the first to recognize the severity of the situation, is a dereliction of duty and a violation of emergency preparedness standards. A third incorrect approach is to administer medications without specific direction from the dentist or EMS. Dental assistants are not authorized to prescribe or administer medications independently in emergency situations, especially those that could be contraindicated or require advanced medical knowledge. This action would constitute practicing beyond the scope of the CDA license and could lead to severe patient harm and legal repercussions. Professional reasoning. In handling medical emergencies, dental professionals must follow a clear decision-making process. 1. Recognize the emergency. Be aware of the signs and symptoms of common medical emergencies. 2. Assess the patient. Quickly evaluate the patient's condition. 3. Activate the emergency response system. Call for EMS immediately. 4. Provide basic life support. Administer care within the scope of practice until EMS arrives. 5. Communicate effectively. Relay vital information to EMS and the dental team. 6. Document the event. Record all actions taken. This systematic approach ensures that patient safety is paramount and that all necessary steps are taken in a timely and appropriate manner in accordance with regulatory requirements and ethical obligations. Question 2. Market research demonstrates that while dental practices generally understand the importance of personal protective equipment, PPE, consistent and correct implementation among all staff members can be a significant challenge. In a busy dental office, A dental assistant observes that some team members occasionally deviate from established PPE protocols, such as reusing disposable masks or not fully covering exposed skin with gowns during procedures with a high risk of splatter. What is the most effective and professionally responsible approach for the dental assistant to address this situation? Option A. Initiate a comprehensive review and retraining session on infection control and PPE protocols for all staff, emphasizing the rationale behind each requirement and providing opportunities for practice and feedback. Option B. Suggest that the office invest in more expensive, reusable PPE options to encourage better care and reduce waste, hoping this will motivate staff. Option C. Discreetly document instances of non-compliance and report them to the office manager for disciplinary action. Option D. Address individual staff members privately and express disappointment, assuming they understand the rules but are choosing not to follow them. The correct answer is A. Initiate a comprehensive review and retraining session on infection control and PPE protocols for all staff, emphasizing the rationale behind each requirement and providing opportunities for practice and feedback. Explanation. Scenario analysis. This scenario presents a common implementation challenge in a dental practice, ensuring consistent and correct use of personal protective equipment, PPE, by all staff members. The challenge lies in the variability of individual adherence to protocols, the potential for complacency, and the need to balance patient safety with staff comfort and workflow efficiency. A dental assistant must navigate these factors while upholding regulatory standards and ethical obligations to prevent the transmission of infectious diseases. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes education, clear communication, and consistent reinforcement of established protocols. This aligns with the principles of infection control mandated by regulatory bodies such as the Occupational Safety and Health Administration, OSHA, in the United States, which requires employers to provide a safe working environment and implement measures to prevent occupational exposure to bloodborne pathogens and other infectious agents. Best professional practice dictates a proactive and comprehensive approach to PPE compliance, ensuring that all team members understand the rationale behind the requirements and are equipped to follow them correctly. This includes regular training, readily accessible and appropriate PPE, and a culture that supports adherence to safety standards. Incorrect approaches analysis. One incorrect approach involves assuming that initial training is sufficient and relying solely on passive observation. This fails to address potential lapses in compliance and neglects the employer's responsibility to actively monitor and enforce safety protocols. Ethically and regulatorily, this passive stance can lead to increased risk of occupational exposure for dental personnel and potential transmission of infections to patients. Another incorrect approach is to address non-compliance through immediate disciplinary action without first understanding the underlying reasons. This can create a climate of fear and discourage open communication about challenges or concerns regarding PPE. While disciplinary action may be necessary in some cases, it should be a last resort after attempts at education and support have failed. Ethically, it is important to approach staff development with a focus on improvement rather than solely punishment. A third incorrect approach is to prioritize speed or convenience over proper PPE usage, such as allowing staff to skip certain steps in donning or doffing PPE when time is perceived to be a constraint. This directly violates infection control guidelines and significantly increases the risk of cross-contamination and occupational exposure. Regulatorily, this is a clear breach of OSHA standards and could result in citations and penalties. Professional reasoning. When faced with challenges in PPE implementation, a dental assistant should employ a systematic decision-making process. This begins with understanding the specific regulatory requirements for PPE in their jurisdiction. Next, they should assess the current situation, identifying any gaps in knowledge or practice. The preferred approach is to implement a plan that includes ongoing education, clear and accessible protocols, regular competency checks, and open communication channels for staff to voice concerns or seek clarification. This proactive and supportive strategy fosters a culture of safety and ensures consistent adherence to best practices, thereby protecting both patients and dental professionals. Question 3. The performance metrics show a consistent increase in image receptor exposure time required to achieve diagnostic quality radiographs across multiple patients, despite no changes in kilovoltage or milliamperage settings. Option A. Immediately increase the kilovoltage to compensate for the longer exposure time and maintain image density. Option B. Reduce the milliamperage to further decrease radiation output, accepting a potential decrease in image quality. Option C. Evaluate the image receptor's sensitivity and the collimator's effectiveness, and adjust exposure factors accordingly to maintain diagnostic quality while minimizing radiation dose. Option D. Continue using the current settings, assuming patient anatomy is the primary cause for the increased exposure time. The correct answer is C. Evaluate the image receptor's sensitivity and the collimator's effectiveness, and adjust exposure factors accordingly to maintain diagnostic quality while minimizing radiation dose. Explanation: scenario analysis. This scenario presents a common challenge in dental radiography, where a dental assistant must interpret performance metrics to optimize image quality and patient safety. The challenge lies in understanding the interplay between exposure factors, image receptor sensitivity, and the diagnostic quality of the radiograph, all within the strict regulatory framework governing radiation use. Accurate interpretation is crucial to avoid unnecessary radiation exposure to patients and staff, while ensuring diagnostic efficacy. Correct approach analysis. The correct approach involves a systematic evaluation of the performance metrics to identify deviations from optimal settings. This includes assessing factors like exposure time, kilovoltage, kVp, and milliamperage MA, in relation to the resultant image density and contrast. Adjusting these parameters based on the observed metrics, while adhering to ALARA, as low as reasonably achievable, principles and state-specific radiation control regulations, ensures that diagnostic quality radiographs are produced with the minimum necessary radiation dose. This aligns with the ethical responsibility to provide quality patient care and the legal mandate to use radiation safely and effectively. Incorrect approaches analysis. One incorrect approach would be to ignore the performance metrics entirely, assuming current settings are adequate. This fails to acknowledge the dynamic nature of equipment performance and patient anatomy, potentially leading to suboptimal images that require retakes, thus increasing patient radiation exposure unnecessarily. This violates the ALARA principle and may contravene state regulations that mandate periodic equipment calibration and performance monitoring. Another incorrect approach would be to arbitrarily increase exposure factors without a clear understanding of their impact. This could lead to overexposure, resulting in radiographs that are too dark, high density, and lack diagnostic detail or excessive scatter radiation. This is a direct contravention of ALARA and state regulations designed to limit patient radiation dose. A third incorrect approach might be to solely focus on reducing exposure time without considering the impact on kVp and MA. While reducing time is a component of dose reduction, insufficient kVp or M can lead to underexposed images with poor contrast, rendering them diagnostically inadequate. This compromises patient care and necessitates retakes, again increasing radiation exposure. Professional reasoning. When faced with performance metrics indicating potential issues in dental radiography, a dental assistant should first consult the manufacturer's guidelines for the specific equipment and imaging system. Next, they should review the established quality assurance protocols for the practice, which are often dictated by state regulations. The assistant should then analyze the metrics in conjunction with recent radiographic quality assessments. If deviations are noted, the assistant should collaborate with the supervising dentist to determine the most appropriate adjustments to exposure factors, prioritizing patient safety and diagnostic yield. This systematic, evidence-based approach, grounded in regulatory compliance and ethical practice, ensures optimal outcomes. Question 4. Process analysis reveals a pattern of suboptimal radiographic image quality in a dental practice, leading to an increased number of retakes. Which of the following approaches best addresses this quality assurance issue within the Certified Dental Assistant Trademark, CDA, regulatory framework? Option A. Conduct a thorough review of the practice's quality assurance program for radiographic procedures, including an assessment of equipment calibration, processing techniques, and staff training, to identify systemic issues contributing to image degradation. Option B. Establish a policy where retakes are only addressed if explicitly flagged by the supervising dentist, without independent monitoring of radiographic quality. Option C. Advise the dental team to accept the current level of image quality as acceptable, given the inherent variability in radiographic procedures, and focus on other practice priorities. Option D. Implement mandatory retraining for all dental assistants on basic radiographic techniques, assuming individual skill deficits are the primary cause of retakes. Correct answer is A. Conduct a thorough review of the practice's quality assurance program for radiographic procedures, including an assessment of equipment calibration, processing techniques, and staff training, to identify systemic issues contributing to image degradation. Explanation. Scenario analysis. This scenario presents a common challenge in dental radiography, ensuring consistent image quality and patient safety while adhering to regulatory standards. The challenge lies in identifying the root cause of recurring radiographic errors and implementing effective corrective actions that go beyond superficial fixes. A dental assistant must possess a keen eye for detail, a thorough understanding of radiographic principles, and the ability to critically evaluate procedures and equipment. The professional responsibility extends to protecting the patient from unnecessary radiation exposure and ensuring diagnostic quality images for accurate treatment planning. Correct approach analysis. The correct approach involves a systematic, data-driven investigation into the quality assurance program for radiographic procedures. This includes reviewing patient records for evidence of retakes, analyzing the frequency and types of errors, and assessing the effectiveness of current protocols. Implementing a comprehensive review of equipment calibration, processing techniques, if applicable, and staff training ensures that all potential sources of error are addressed. This proactive and analytical method aligns with the principles of quality assurance mandated by regulatory bodies, which emphasize continuous improvement and evidence-based practice to maintain high standards of patient care and safety. This approach directly addresses the underlying issues contributing to radiographic deficiencies, thereby enhancing diagnostic accuracy and minimizing patient exposure. Incorrect approaches analysis. One incorrect approach is to solely rely on individual staff member retraining without investigating systemic issues. While retraining can be beneficial, it fails to address potential equipment malfunctions, outdated techniques, or inadequate protocols that might be the true source of errors. This approach is professionally deficient because it places blame on individuals rather than identifying and rectifying broader operational problems, potentially leading to repeated errors and continued patient risk. Another incorrect approach is to dismiss recurring errors as unavoidable or minor inconveniences. This demonstrates a lack of commitment to quality assurance and patient safety. Regulatory frameworks for dental assisting emphasize the importance of minimizing errors and ensuring diagnostic quality. Ignoring or downplaying these issues constitutes a failure to uphold professional standards and could lead to suboptimal patient care and potential legal or ethical repercussions. A third incorrect approach is to only address errors when they are reported by the dentist, without an independent system for monitoring and evaluating radiographic quality. This reactive stance is insufficient for a robust quality assurance program. Proactive monitoring and analysis are essential to identify trends and prevent errors before they significantly impact patient care or lead to repeated exposures. This passive approach fails to meet the expected standard of care and regulatory expectations for a comprehensive quality assurance system. Professional reasoning. Professionals should approach quality assurance in radiographic procedures with a mindset of continuous improvement. This involves establishing clear protocols, regularly monitoring performance, and using data to identify areas for enhancement. When errors occur, the decision-making process should focus on root cause analysis rather than immediate blame. This includes evaluating equipment, techniques, and training. Implementing corrective actions should be based on this analysis, with a plan for follow-up to ensure effectiveness. Adherence to regulatory guidelines and ethical principles, particularly regarding patient safety and diagnostic accuracy, should guide all decisions. Question 5. Cost-benefit analysis shows that implementing a comprehensive post-exposure evaluation and follow-up protocol for bloodborne pathogens is essential for a dental practice. Following a needle-stick injury involving a patient's blood, what is the most appropriate immediate course of action for a certified dental assistant trademark, CDA, to ensure compliance with OSHA regulations and best professional practice? Option A. Discard the contaminated Sharps device and wait until the end of the workday to report the incident. Option B. Rinse the affected area with water only and document the incident in personal notes for later review. Option C. Immediately wash the affected area thoroughly with soap and water and report the incident to the supervising dentist or office manager. Option D. Apply an antiseptic wipe to the affected area and continue with the scheduled patient procedures. The correct answer is C. Immediately wash the affected area thoroughly with soap and water and report the incident to the supervising dentist or office manager. Explanation: this scenario is professionally challenging because it requires a dental assistant to balance immediate patient care with stringent regulatory compliance regarding bloodborne pathogen exposure control. The assistant must make a rapid, informed decision that prioritizes safety for themselves, the patient, and others in the dental setting, while also adhering to established protocols. The core of the challenge lies in the potential for exposure and the need for immediate correct action to mitigate risks. The correct approach represents best professional practice because it directly aligns with the Occupational Safety and Health Administration's OSHA Bloodborne Pathogen Standard 29 CFR 1910-1030. This standard mandates specific procedures for post-exposure evaluation and follow-up, including immediate washing of the affected area and reporting the incident to a supervisor or designated person. Prompt reporting is crucial for initiating the exposure control plan, which may involve medical evaluation, testing, and prophylaxis to prevent transmission of serious infections like HIV, hepatitis B, and hepatitis C. This approach ensures that all regulatory requirements are met, minimizing legal and ethical liabilities for the dental practice and safeguarding the health of the assistant. An incorrect approach that involves delaying reporting or attempting to self-manage the exposure without following established protocols is a significant regulatory and ethical failure. OSHA regulations are clear on the employer's responsibility to provide a safe working environment and to have a written exposure control plan. Failing to report an exposure incident immediately violates the spirit and letter of these regulations, potentially leading to delayed or inadequate medical intervention for the assistant. Ethically, it demonstrates a disregard for personal safety and the established procedures designed to protect healthcare workers. Another incorrect approach, such as dismissing the incident as minor without proper evaluation, ignores the potentially severe consequences of bloodborne pathogen transmission and fails to uphold the duty of care owed to employees. This can result in a breach of professional responsibility and a failure to comply with the employer's obligation to manage workplace hazards. The professional decision-making process for similar situations should involve a clear understanding of the dental practice's exposure control plan. Upon any potential exposure, the immediate steps are to cease the procedure if possible, safely remove any contaminated personal protective equipment, and thoroughly wash the affected area with soap and water. Following this, immediate reporting to the designated supervisor or office manager is paramount. This triggers the practice's established protocol for post-exposure management, ensuring that all necessary steps, including medical evaluation and documentation, are taken in a timely manner. This systematic approach prioritizes safety, regulatory compliance, and ethical responsibility. Question 6. Market research demonstrates that patients are increasingly concerned about radiation exposure from dental imaging. A patient presents for a consultation regarding elective cosmetic bonding and expresses significant anxiety about undergoing dental X-rays, stating, "I've heard so many bad things about radiation, and I don't want any if I can avoid it." The dentist has indicated that a full series of dental radiographs is necessary for a comprehensive assessment before proceeding with the cosmetic treatment. As a certified dental assistant trademark, CDA, what is the most appropriate course of action? Option A. Agree to forego the radiographs entirely to alleviate the patient's anxiety, as the procedure is elective cosmetic bonding. Option B. Thoroughly explain the benefits of the radiographs for accurate diagnosis and treatment planning, discuss the minimal risks associated with modern dental imaging, and obtain informed consent from the patient before proceeding. Option C. Inform the patient that they must undergo the radiographs as prescribed by the dentist, as refusal is not an option for elective procedures. Option D. Proceed with taking the radiographs as ordered by the dentist, assuring the patient that the radiation dose is negligible and that it's a standard procedure. The correct answer is B. Thoroughly explain the benefits of the radiographs for accurate diagnosis and treatment planning, discuss the minimal risks associated with modern dental imaging, and obtain informed consent from the patient before proceeding. Explanation. Scenario analysis. This scenario presents a common ethical and legal challenge in dental radiography. The challenge lies in balancing the patient's right to informed consent and autonomy with the dentist's professional judgment regarding the necessity of radiographic imaging for diagnosis and treatment planning. The patient's apprehension about radiation exposure, coupled with their desire for a specific cosmetic outcome, creates a conflict that requires careful navigation to uphold both legal and ethical standards. Correct approach analysis. The correct approach prioritizes obtaining informed consent by thoroughly explaining the risks and benefits of dental radiography. This aligns with the fundamental ethical principle of patient autonomy and the legal requirement for informed consent before any medical procedure, including diagnostic imaging. By detailing the potential risks of radiation exposure, however minimal, and the diagnostic benefits of the radiographs for accurate treatment planning, the dental assistant empowers the patient to make a knowledgeable decision. This also upholds the principle of beneficence by ensuring the treatment is based on sound diagnostic information. Incorrect approaches analysis. One incorrect approach involves proceeding with the radiographs without fully addressing the patient's concerns or obtaining explicit consent. This violates the principle of patient autonomy and the legal requirement for informed consent, potentially leading to a battery claim if the procedure is performed without permission. It also fails to uphold the principle of non-maleficence by not adequately informing the patient of potential risks. Another incorrect approach is to dismiss the patient's concerns about radiation and proceed with the imaging solely based on the dentist's directive. This disregards the patient's right to be informed and to participate in their healthcare decisions. Ethically, it undermines the patient-provider relationship, and legally, it could be seen as a failure to obtain proper consent. A third incorrect approach is to agree to forego the radiographs entirely without a thorough professional assessment of the diagnostic necessity. While respecting patient wishes is important, a dental assistant has a professional and ethical obligation to ensure that diagnostic procedures are performed when indicated for patient care. Abandoning necessary diagnostic steps without proper justification could compromise patient safety and lead to suboptimal treatment outcomes, violating the principle of beneficence. Professional reasoning. When faced with a patient's apprehension about radiography, a dental professional should follow a structured decision-making process. First, actively listen to and acknowledge the patient's concerns. Second, provide clear, understandable information about the purpose of the radiographs, the benefits they offer for diagnosis and treatment, and the minimal risks associated with modern dental imaging techniques. Third, discuss alternative diagnostic methods if any are appropriate and available, explaining their limitations. Fourth, document the conversation and the patient's decision thoroughly. If the patient still refuses necessary radiographs, the dentist must assess the implications for treatment and discuss these with the patient, potentially involving a referral if the patient's concerns cannot be adequately addressed within the practice. Question 7. Strategic planning requires a dental assistant to anticipate the needs of a patient requiring a restoration in a posterior tooth where aesthetics are a significant concern for the patient. The preparation is adequate for material that requires light curing and good moisture control. Considering the common dental materials available and their properties, which material selection best aligns with these clinical and patient-driven requirements? Option A. Zinc phosphate cement. Option B. Alginate impression material. Option C. Composite resin. Option D. Dental amalgam. The correct answer is C. Composite resin. Explanation. This scenario is professionally challenging because the dental assistant must select the most appropriate material for a specific clinical situation, considering not only the material's properties but also patient factors and the dentist's instructions. This requires a thorough understanding of common dental materials and their applications, as well as adherence to the Certified Dental Assistant Trademark, CDA, scope of practice, and relevant state dental board regulations. The correct approach represents best professional practice because it prioritizes patient well-being and the integrity of the dental restoration. Selecting a composite resin for a posterior restoration where aesthetics are a primary concern, and the preparation allows for adequate isolation and curing, aligns with modern dental practices that emphasize conservative and aesthetic treatments. This choice is supported by the understanding that composites offer good aesthetics and biocompatibility when properly placed. An incorrect approach would be to select an amalgam for a posterior restoration where aesthetics are a significant patient concern, or if the preparation is too small to adequately retain amalgam. This would fail to meet patient expectations and could lead to premature restoration failure. Ethically, it disregards patient preference and potentially compromises the quality of care. Regulatory failure would occur if the chosen material is not within the scope of practice for a dental assistant to select, or if it contravenes established clinical guidelines for that specific situation. Another incorrect approach would be to choose a glass ionomer cement for a direct posterior restoration that is subject to heavy occlusal forces. While glass ionomers have their place, they are generally not indicated for high-stress bearing areas as a primary restorative material due to their lower strength and wear resistance compared to composites or amalgams. This would lead to a high likelihood of restoration fracture or wear, necessitating replacement and potentially causing patient discomfort. This represents a failure in clinical judgment and could be considered negligent care. A further incorrect approach would be to select an impression material without considering the specific requirements of the impression. For example, using a fast-setting alginate for a full-arch impression that requires significant detail and minimal distortion for crown preparation would be inappropriate. Alginate is a less precise material than elastomeric impression materials and is better suited for preliminary impressions for study models or opposing arches. Using it for a final impression for a crown would likely result in an inaccurate model, leading to a poorly fitting restoration and potential remakes, which is inefficient and compromises patient care. This demonstrates a lack of understanding of material properties and their appropriate clinical applications. The professional decision-making process should involve 1. Understanding the dentist's diagnosis and treatment plan. 2. Identifying the clinical requirements of the procedure, e.g., location in the mouth, aesthetic demands, occlusal forces, need for isolation. 3. Recalling the properties and indications for use of various dental materials. 4. Considering patient-specific factors, e.g., allergies, aesthetic preferences. And 5. Selecting the material that best meets all these criteria while remaining within the scope of practice and adhering to ethical guidelines. Question 8. The efficiency study reveals that a dental assistant is observing a patient's gingival margin and the surrounding structures. The assistant needs to accurately describe the components of the periodontium visible. Which of the following descriptions demonstrates the most precise understanding of periodontal anatomy? Option A. The bone supporting the teeth is visible, and the ligament connects the tooth to the bone. Option B. The gums are pink and healthy-looking, with some space between the teeth. Option C. The soft tissue around the teeth is the gingiva, and it holds the teeth in place. Option D. The attached gingiva is firm and stippled, extending from the mucogingival junction to the free gingival groove, and the interdental papilla fills the interproximal space. Correct answer is D. The attached gingiva is firm and stippled, extending from the mucogingival junction to the free gingival groove, and the interdental papilla fills the interproximal space. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental assistant to accurately identify and describe specific periodontal structures based on visual cues and their understanding of periodontal anatomy. Misidentification can lead to incorrect documentation, flawed treatment planning, and ultimately compromise patient care. The assistant must demonstrate a precise understanding of the gingiva, periodontal ligament, alveolar bone, and cementum, and their relative positions and functions. Correct approach analysis. The correct approach involves accurately identifying the structures based on their anatomical location and characteristics. This demonstrates a strong foundational knowledge of periodontal anatomy, which is crucial for effective patient care, accurate charting, and clear communication with the dentist. Adherence to proper anatomical terminology is a professional standard and is implicitly required by the CDA certification to ensure consistent and reliable patient records. Incorrect approaches analysis. One incorrect approach would be to generalize or use imprecise terminology when describing the structures. For example, referring to all soft tissue around the tooth as gums without distinguishing between the free gingiva, attached gingiva, or interdental papilla. This lacks the specificity required for accurate dental charting and communication, potentially leading to misunderstandings about the extent of periodontal disease or the success of treatment. Another incorrect approach would be to confuse the location or function of different periodontal tissues. For instance, mistaking the periodontal ligament for the gingiva or incorrectly describing the role of alveolar bone in supporting the tooth. Such errors indicate a fundamental misunderstanding of periodontal anatomy, which could result in incorrect assessments of periodontal health and inappropriate recommendations or interventions. A third incorrect approach would be to focus on superficial characteristics without understanding the underlying anatomical significance. For example, describing the color of the gingiva without noting its contour or consistency, which are critical indicators of periodontal health. This superficial observation fails to capture the essential anatomical and pathological information needed for effective dental practice. Professional reasoning. Professionals should approach such situations by systematically evaluating the visual information presented, recalling precise anatomical definitions, and applying them to the specific structures observed. This involves a process of observation, recall, and application, ensuring that terminology is accurate and descriptions are clinically relevant. When in doubt, consulting anatomical references or seeking clarification from a supervising dentist is a hallmark of responsible professional practice. Question 9. The risk matrix shows a patient has been assessed as having a high risk for developing dental caries. The dentist has prescribed a fluoride varnish application and recommended a reduction in sugary snack consumption. As a certified dental assistant trademark, CDA, which of the following actions best aligns with your regulatory responsibilities and professional practice in managing this patient's caries risk? Option A. Advise the patient to schedule an appointment with a nutritionist to discuss their diet, as dietary changes are solely outside the scope of dental assistant responsibilities. Option B. Inform the patient that the risk matrix is a general tool and that their current oral hygiene habits are likely sufficient, downplaying the need for significant dietary changes. Option C. Reinforce the dentist's prescribed fluoride varnish application and educate the patient on the importance of reducing sugary snack consumption, explaining how this directly relates to their high caries risk assessment. Option D. Independently recommend a prescription-strength fluoride toothpaste and a more frequent brushing schedule without consulting the dentist. The correct answer is C. Reinforce the dentist's prescribed fluoride varnish application and educate the patient on the importance of reducing sugary snack consumption, explaining how this directly relates to their high caries risk assessment. Explanation. Scenario analysis. This scenario presents a challenge because a dental assistant must interpret a caries risk assessment tool and translate its findings into appropriate management strategies, all while adhering to the specific scope of practice and regulatory guidelines for certified dental assistants, trademark CDA, in the United States. The assistant must balance the dentist's overall treatment plan with their direct responsibilities in patient education and preventive care, ensuring that recommendations are evidence-based and within their professional purview. Correct approach analysis. The correct approach involves the dental assistant utilizing the information from the risk matrix to reinforce the dentist's prescribed preventive measures and provide tailored patient education. This aligns with the CDA's role in supporting oral hygiene instruction and promoting patient understanding of caries risk factors and management. Regulatory frameworks for CDAs emphasize their role in patient education and assisting in preventive procedures, making this approach best professional practice. It ensures continuity of care and empowers the patient to actively participate in their oral health management, as guided by the dentist. Incorrect approach is analysis. One incorrect approach would be for the dental assistant to independently alter the prescribed preventive regimen without direct dentist authorization. This violates the scope of practice for a CDA, as treatment planning and modification are the responsibility of the licensed dentist. Such an action could lead to inappropriate care and potential harm to the patient, contravening ethical obligations and regulatory mandates. Another incorrect approach would be for the dental assistant to dismiss the findings of the risk matrix as irrelevant to their duties. This demonstrates a lack of professional engagement and a failure to recognize the importance of preventive care in overall oral health. It neglects the ethical responsibility to contribute to the patient's well-being and may indicate a misunderstanding of the CDA's role in supporting comprehensive dental care. A third incorrect approach would be for the dental assistant to provide generalized oral hygiene advice that does not specifically address the identified high-risk factors indicated by the matrix. This fails to leverage the diagnostic information to provide targeted and effective patient education, thus diminishing the value of the risk assessment and potentially leaving the patient vulnerable to further caries development. It represents a missed opportunity for personalized preventive care, which is a core competency for a CDA. Professional reasoning. When faced with a caries risk assessment, a dental assistant should first understand the dentist's diagnosis and treatment plan. They should then use the risk assessment data to inform their patient education, reinforcing the dentist's recommendations and explaining the rationale behind them in an understandable manner. This involves active listening to the patient's concerns, demonstrating empathy, and providing clear, actionable advice on oral hygiene practices, dietary modifications, and the importance of regular dental visits, all within the scope of their licensure and the dentist's directive. Question 10. Compliance review shows that a dentist has requested a dental radiograph for a patient presenting with a localized, persistent toothache in the posterior quadrant. The dental assistant is unsure whether the dentist requires a detailed view of a specific tooth or a broader overview of the entire quadrant. What is the most appropriate course of action for the dental assistant in this situation? Option A. Take a series of biodoing radiographs, as they are commonly used for detecting decay in posterior teeth. Option B. Ask the dentist to clarify the specific diagnostic purpose of the radiograph to determine whether an intraoral periapical or biodoing radiograph is most suitable for assessing the toothache. Option C. Inform the dentist that a radiograph is not necessary at this time and suggest waiting for further symptoms. Option D. Proceed with taking a panoramic radiograph, as it provides a comprehensive view of all teeth and surrounding structures. The correct answer is B. Ask the dentist to clarify the specific diagnostic purpose of the radiograph to determine whether an intraoral periapical or biodoing radiograph is most suitable for assessing the toothache. Explanation. This scenario presents a professional challenge due to the potential for misinterpretation of patient needs and the subsequent impact on diagnostic accuracy and patient care. The dental assistant must balance the dentist's request with their understanding of appropriate radiographic techniques for different clinical situations. Careful judgment is required to ensure that the chosen radiograph provides the necessary diagnostic information without exposing the patient to unnecessary radiation or failing to capture critical details. The correct approach involves understanding the diagnostic purpose of each type of radiograph. Intraoral radiographs, such as periapical and biodoing films, provide detailed images of individual teeth and surrounding bone, making them ideal for detecting interproximal decay, bone loss, and root abnormalities. Extraoral radiographs, like panoramic films, offer a broader view of the entire jaw and facial structures, useful for assessing impacted teeth, jaw fractures, and overall dental development. When the dentist requests a radiograph without specifying the type, the assistant's professional responsibility is to clarify the diagnostic objective to select the most appropriate imaging modality. This ensures optimal diagnostic yield and adherence to the ALARA, as low as reasonably achievable principle, by avoiding unnecessary exposures. An incorrect approach would be to assume the dentist's request implies a specific type of radiograph without confirmation. For instance, performing a panoramic radiograph when the clinical indication clearly points to the need for detailed periapical views of a specific tooth would be a failure to provide adequate diagnostic information. This could lead to delayed or misdiagnoses, impacting patient treatment and potentially violating professional standards of care. Similarly, performing multiple intraoral radiographs when a single extraoral image would suffice for a preliminary assessment could result in unnecessary radiation exposure and increased patient discomfort, contravening the ALARA principle. Another incorrect approach would be to proceed with a radiograph that is not indicated for the patient's presenting complaint, such as taking a biodoing for a patient complaining of a toothache in the anterior region, where a periapical radiograph is more appropriate. This demonstrates a lack of clinical judgment and understanding of radiographic indications. Professional decision-making in such situations requires a systematic approach. First, the dental assistant should actively listen to the dentist's request and consider the patient's chief complaint and any preliminary clinical findings. Second, they should access their knowledge of different radiographic types and their diagnostic applications. Third, if the request is ambiguous, the assistant must engage in clear and concise communication with the dentist to ascertain the specific diagnostic goals. This collaborative approach ensures that the most appropriate radiograph is selected, maximizing diagnostic value while minimizing patient risk. Question 11. Operational review demonstrates a patient presenting with a chief complaint of dry mouth and difficulty initiating the breakdown of food during meals, particularly when chewing on the right side of their mouth. Based on the known functions of the major salivary glands and their typical locations, which of the following is the most likely gland to be primarily involved in these symptoms? Option A, the submandibular gland. Option B, the sublingual gland. Option C, the minor salivary glands. Option D, the parotid gland. The correct answer is D, the parotid gland. Explanation: scenario analysis. This scenario presents a challenge in accurately identifying the source of a patient's discomfort related to salivary gland function, requiring the dental assistant to apply their knowledge of anatomy and physiology within the scope of practice. Misidentification can lead to ineffective treatment, patient dissatisfaction, and potential delays in proper diagnosis and care. Correct approach analysis. The correct approach involves systematically assessing the patient's symptoms in relation to the known functions of the major salivary glands. Understanding that the parotid glands are primarily responsible for serous, watery saliva, which aids in initial carbohydrate digestion and lubrication, and that their ducts open near the molars, allows for a targeted assessment of symptoms like difficulty initiating digestion or discomfort in the cheek area. This aligns with the CDA's role in assisting with patient assessment and education under the supervision of a dentist. Incorrect approaches analysis. One incorrect approach would be to assume the issue is solely related to tooth decay without considering other oral structures. This fails to acknowledge the comprehensive oral health assessment required and could lead to overlooking a salivary gland issue, thus delaying appropriate dental intervention. Another incorrect approach would be to recommend over-the-counter pain relievers without a proper diagnosis. This bypasses the dentist's role in diagnosis and treatment planning and could mask symptoms, making it harder to identify the root cause of the problem. It also falls outside the scope of practice for a CDA to prescribe or recommend medication without direct dentist instruction. A third incorrect approach would be to focus solely on the submandibular or sublingual glands without considering the parotid glands. While all salivary glands produce saliva, their specific contributions and locations differ, and a generalized approach without considering the patient's reported symptoms and the anatomical location of potential issues would be inefficient and potentially inaccurate. Professional reasoning. Dental assistants should approach patient concerns by first gathering detailed information about the symptoms, including location, duration, and any associated factors. They should then correlate these symptoms with their knowledge of oral anatomy and physiology, specifically the functions of salivary glands. Any findings or concerns should be promptly communicated to the supervising dentist for further evaluation and diagnosis. This systematic approach ensures patient safety, promotes effective communication within the dental team, and upholds professional standards. Question 12. Assessment of a dental radiograph reveals a radiolucent area at the apex of a tooth that appears larger than a typical physiological foramen. What is the most appropriate action for a certified dental assistant trademark, CDA, to take in this situation? Option A. Inform the patient that they likely have an infection requiring root canal therapy. Option B. Advise the patient to schedule an appointment with a specialist without consulting the dentist. Option C. Document the observation and report it to the supervising dentist for their evaluation and diagnosis. Option D. Make a note to re-examine the radiograph at the patient's next routine cleaning appointment. The correct answer is C. Document the observation and report it to the supervising dentist for their evaluation and diagnosis. Explanation: scenario analysis. This scenario is professionally challenging because interpreting dental radiographs requires a combination of technical knowledge, clinical experience, and adherence to established diagnostic standards. A dental assistant, even when assisting, must be able to recognize potential anomalies and understand the limitations of their role in interpretation, ensuring patient safety and accurate treatment planning. The challenge lies in distinguishing between normal anatomical variations and pathological conditions, and knowing when to escalate findings to the supervising dentist. Correct approach analysis. The correct approach represents best professional practice because it aligns with the fundamental principles of dental radiography and the scope of practice for a certified dental assistant trademark. CDA. A CDA is trained to identify and report deviations from normal anatomy, but the definitive diagnosis and treatment planning are the responsibility of the licensed dentist. This approach ensures that findings are communicated accurately and promptly to the dentist for their expert evaluation, thereby upholding patient care standards and regulatory compliance regarding the practice of dentistry. Incorrect approach is analysis. One incorrect approach involves making a definitive diagnosis based on the radiograph. This is a regulatory and ethical failure because it exceeds the scope of practice for a dental assistant. Diagnosing conditions is the exclusive purview of a licensed dentist, and a dental assistant performing this function would be engaging in the unlicensed practice of dentistry, which is a serious violation. Another incorrect approach is to ignore or dismiss a subtle but potentially significant finding on the radiograph. This represents an ethical failure in patient advocacy and professional responsibility. A CDA has a duty to report any observed abnormalities, even if they seem minor, as early detection can be crucial for successful treatment outcomes. Failing to report could lead to delayed diagnosis and compromised patient health, violating the principle of do no harm. A third incorrect approach is to overinterpret or speculate about findings without sufficient evidence or expertise. While it is important to report observations, a CDA should not offer speculative diagnoses or prognoses. This can lead to unnecessary patient anxiety or misdirection of treatment. The ethical failure here is in providing information beyond one's professional competence, potentially undermining the dentist's authority and confusing the patient. Professional reasoning. Professionals should employ a systematic decision-making process when interpreting dental radiographs. This involves 1. Ensuring the radiograph is of diagnostic quality. 2. Systematically examining all areas of the radiograph for normal anatomical landmarks. 3. Identifying any deviations from normal. 4. Documenting these observations objectively. And 5. Communicating these findings clearly and concisely to the supervising dentist for their professional diagnosis and treatment planning. This process ensures accuracy, ethical conduct, and adherence to regulatory requirements. Question 13. Operational review demonstrates the dental practice is considering the adoption of a new digital radiography system. Which of the following approaches best ensures compliance with regulatory requirements and patient safety protocols during this transition? Option A. Conduct a comprehensive risk assessment to identify potential hazards, evaluate their impact, and implement mitigation strategies before full implementation. Option B. Prioritize the cost savings and efficiency gains offered by the new system, assuming it will inherently improve patient care. Option C. Implement the new system immediately and address any issues that arise on a case-by-case basis after patient use. Option D. Proceed with the installation and training based solely on the manufacturer's provided documentation and recommendations. The correct answer is A. Conduct a comprehensive risk assessment to identify potential hazards, evaluate their impact, and implement mitigation strategies before full implementation. Explanation. Scenario analysis. This scenario presents a professional challenge related to the implementation of new digital radiography technology in a dental practice. The core challenge lies in ensuring that the adoption of this technology not only enhances diagnostic capabilities, but also adheres to all relevant regulatory requirements for patient safety, data security, and professional competency. The risk assessment approach is crucial because it proactively identifies potential hazards associated with the new system and develops strategies to mitigate them, thereby preventing adverse patient outcomes or regulatory noncompliance. Correct approach analysis. The correct approach involves a comprehensive risk assessment that systematically identifies potential hazards associated with digital radiography, evaluates their likelihood and impact, and implements appropriate control measures. This aligns with the ethical obligation of dental professionals to provide safe and effective patient care. Regulatory frameworks, such as those governing patient privacy, e.g., HIPAA in the U.S., and equipment safety, mandate that practices implement measures to protect patient information and ensure the proper functioning of medical devices. A thorough risk assessment ensures that the practice is not only compliant with these regulations, but also proactively addresses potential issues before they affect patient care or data integrity. This approach demonstrates a commitment to continuous quality improvement and patient well-being. Incorrect approach is analysis. Implementing the new system without a formal risk assessment, assuming it will inherently improve care, is a significant regulatory and ethical failure. This approach neglects the potential for unforeseen technical issues, cybersecurity vulnerabilities, or inadequate staff training, all of which could compromise patient safety and data privacy. It bypasses the due diligence required by regulatory bodies that expect practices to have robust systems in place to manage risks associated with new technologies. Focusing solely on the cost-effectiveness of the new digital radiography system, without considering its impact on patient care and data security, represents a failure to prioritize patient well-being and regulatory compliance. Financial considerations are important. They must not supersede the ethical and legal responsibilities to provide safe and secure dental care. This approach could lead to overlooking critical safety features or data protection measures, potentially resulting in breaches or suboptimal diagnostic outcomes. Relying exclusively on the manufacturer's recommendations for implementation and operation, without an independent risk assessment tailored to the specific practice environment, is also a regulatory and ethical oversight. While manufacturer guidelines are valuable, they may not encompass all potential risks unique to a particular practice's workflow, existing infrastructure, or patient population. A practice has a responsibility to conduct its own assessment to ensure the technology is integrated safely and effectively within its specific context, meeting all applicable legal and ethical standards. Professional reasoning. Professionals should approach the implementation of new technologies by first understanding the regulatory landscape governing their practice. This includes identifying all applicable federal, state, and local laws and guidelines related to patient privacy, data security, radiation safety, and equipment standards. The next step is to conduct a thorough risk assessment involving all relevant team members to identify potential hazards, evaluate their severity, and develop mitigation strategies. This process should be documented and reviewed regularly. Finally, ongoing training and competency assessments for staff are essential to ensure the safe and effective use of the new technology, reinforcing the commitment to patient safety and regulatory compliance. Question 14. The efficiency study reveals that a new protocol for oral hygiene instruction can reduce patient chair time by 15% by streamlining the demonstration of brushing and flossing techniques. However, this protocol omits detailed discussion of dietary influences on oral health and the importance of regular dental checkups. Considering the principles of preventive dentistry and the role of a certified dental assistant trademark, which of the following represents the most appropriate response to this study's findings? Option A. Adopt the new protocol for all patients, assuming that the dentist will cover the omitted topics and prioritize the time savings to increase patient throughput. Option B. Modify the new protocol to include a brief mention of diet and checkups while still aiming for the 15% time reduction, ensuring that the core brushing and flossing demonstration remains efficient. Option C. Integrate the new protocol, focusing on efficient brushing and flossing demonstrations, and inform patients that detailed discussions on diet and checkups will be handled by the dentist during their examination. Option D. Reject the new protocol entirely and continue with the existing, more comprehensive oral hygiene instruction, prioritizing thorough patient education over time savings. Correct answer is C. Integrate the new protocol, focusing on efficient brushing and flossing demonstrations, and inform patients that detailed discussions on diet and checkups will be handled by the dentist during their examination. Explanation. Scenario analysis. This scenario presents a challenge in balancing the immediate need for patient comfort and perceived efficiency with the long-term principles of preventive dentistry and evidence-based practice. A dental assistant must critically evaluate the findings of an efficiency study and determine if it aligns with established preventive care guidelines and patient well-being, rather than blindly adopting a new protocol based solely on time savings. The core challenge lies in discerning between genuine improvement in preventive care delivery and a superficial change that might compromise oral health outcomes. Correct approach analysis. The correct approach prioritizes patient education and the integration of evidence-based preventive strategies. This aligns with the fundamental principles of preventive dentistry, which emphasize patient empowerment and the use of proven methods to reduce oral disease. Regulatory frameworks for dental assistants, such as those governed by the Certified Dental Assistant Trademark, CDA, credential, mandate adherence to ethical standards and the provision of care that promotes optimal patient health. Therefore, incorporating patient education on self-care and utilizing fluoride varnish, a recognized preventive measure, directly supports these professional obligations and best practices. Incorrect approaches analysis. One incorrect approach focuses solely on reducing chair time without considering the impact on preventive education. This fails to meet the ethical obligation to provide comprehensive preventive care and may violate guidelines that emphasize patient understanding of oral hygiene. Another incorrect approach might involve implementing a new technique without proper training or validation, which could lead to inconsistent or ineffective preventive measures, potentially contravening standards of care and patient safety. A third incorrect approach that neglects the importance of patient-specific needs and focuses only on a standardized, time-saving procedure overlooks the individualized nature of preventive dentistry and the ethical imperative to tailor care to each patient's unique risk factors and oral health status. Professional reasoning. Dental assistants should approach efficiency studies with a critical lens, always prioritizing patient well-being and evidence-based preventive practices. The decision-making process should involve 1. Understanding the core principles of preventive dentistry as outlined by professional bodies and regulatory guidelines. 2. Evaluating any proposed changes against these principles and current scientific evidence. 3. Considering the impact on patient education and engagement. 4. Ensuring any new protocols are properly trained and validated. And 5. Always advocating for patient-centered care that promotes long-term oral health. Question 15. To address the challenge of preventing the transmission of infectious agents in a dental setting, a dental assistant is presented with a patient exhibiting symptoms suggestive of a respiratory infection. Considering the principles of standard precautions and the potential need for transmission-based precautions, which of the following actions best reflects a comprehensive and compliant approach to infection control in this scenario? Option A. Implement standard precautions and, given the patient's symptoms, immediately escalate to contact precautions, including wearing gloves and a gown, and disinfecting all surfaces with a broad-spectrum disinfectant. Option B. Implement standard precautions and, due to the respiratory symptoms, also implement droplet precautions, which include wearing a surgical mask, eye protection and gloves, and ensuring proper room ventilation. Option C. Implement standard precautions, including appropriate personal protective equipment, PPE, such as gloves, mask, and eye protection, and ensure thorough hand hygiene before and after patient contact. Option D. Implement standard precautions and, based on the suspicion of a highly contagious airborne pathogen, implement airborne precautions, requiring the use of an N95 respirator, eye protection, and gloves, and ensuring the patient is seen in an isolation room. Correct answer is C. Implement standard precautions, including appropriate personal protective equipment, PPE, such as gloves, mask, and eye protection, and ensure thorough hand hygiene before and after patient contact. Explanation. This scenario presents a professional challenge because it requires a dental assistant to critically evaluate different methods of infection control in a real-time clinical setting, balancing patient safety with efficient workflow. The core of the challenge lies in accurately applying the principles of standard precautions and transmission-based precautions based on the specific clinical situation and the known or suspected infectious status of the patient. Careful judgment is required to select the most appropriate and effective combination of measures to prevent the transmission of pathogens. The correct approach represents best professional practice because it demonstrates a thorough understanding and application of the Centers for Disease Control and Prevention, CDC guidelines for infection control, which are the foundational regulatory framework for dental assistants in the United States. Adhering to these guidelines ensures the highest level of patient and healthcare worker safety by systematically addressing potential routes of transmission. This approach prioritizes evidence-based practices and a proactive stance on infection prevention, aligning with the ethical obligation to provide safe and competent care. An incorrect approach that relies solely on standard precautions when transmission-based precautions are indicated fails to adequately protect against specific pathogens that may be transmitted through airborne, droplet, or contact routes. This represents a significant regulatory and ethical failure, as it deviates from established guidelines designed to prevent the spread of infectious diseases, potentially endangering both the patient and other individuals in the healthcare setting. Another incorrect approach that overuses transmission-based precautions unnecessarily can lead to inefficiency and increased resource utilization, without a corresponding increase in safety, potentially impacting patient comfort and the overall clinic workflow, and may not be supported by the specific clinical indication. A third incorrect approach that neglects to consider the specific mode of transmission for a suspected or confirmed infection demonstrates a lack of critical thinking and adherence to established protocols, leading to an inadequate and potentially dangerous infection control strategy. Professional decision-making in such situations should involve a systematic assessment of the patient's condition and the procedures to be performed. This includes reviewing patient history for any signs or symptoms of infection, understanding the potential transmission routes of common pathogens encountered in dentistry, and knowing when to implement enhanced precautions beyond standard measures. The dental assistant should always consult with the supervising dentist if there is any uncertainty regarding the appropriate infection control protocols. Question 16. The control framework reveals that when assessing a patient presenting with symptoms suggestive of temporomandibular joint (TMJ) dysfunction, which anatomical understanding is most critical for a certified dental assistant (CDA) to accurately communicate with the supervising dentist. Option A. The superficial location of the ear canal and its proximity to the TMJ. Option B. A general understanding of the jaw as a single bone that hinges in place. Option C. The precise relationship between the mandibular condyle, the articular disc, and the glenoid fossa, and how their movement is facilitated by surrounding musculature and ligaments. Option D. The common causes of tooth decay and their impact on jaw alignment. The correct answer is C. The precise relationship between the mandibular condyle, the articular disc, and the glenoid fossa, and how their movement is facilitated by surrounding musculature and ligaments. Explanation. The control framework reveals that a certified dental assistant, CDA, must possess a thorough understanding of the anatomy of the temporomandibular joint, TMJ, to effectively assist in patient care and communicate with the dental team. This scenario is professionally challenging because a misunderstanding of TMJ anatomy can lead to incorrect patient positioning, misinterpretation of symptoms, and ineffective communication with the dentist, potentially impacting treatment outcomes and patient comfort. The correct approach represents best professional practice because it demonstrates a comprehensive and accurate application of anatomical knowledge. This aligns with the CDA's responsibility to support the dentist in diagnosis and treatment planning by providing precise information and assisting with procedures that involve the TMJ. Adherence to anatomical accuracy is a fundamental ethical and professional obligation, ensuring patient safety and quality of care, as mandated by the regulatory framework governing CDAs. An incorrect approach that focuses on superficial or generalized joint structures, rather than the specific components of the TMJ, e.g., condyle, fossa, disc, ligaments, fails to meet the required level of anatomical expertise. This could lead to errors in patient assessment, such as misidentifying the source of pain or dysfunction, and could result in the dentist proceeding with treatment based on incomplete or inaccurate information. Ethically, this represents a failure to uphold the standard of care expected of a CDA. Another incorrect approach that relies on anecdotal information or patient self-diagnosis regarding TMJ issues, without grounding in anatomical principles, is professionally unacceptable. This bypasses the established diagnostic process and undermines the dentist's authority and expertise. It also poses a risk to the patient by potentially delaying appropriate medical intervention or leading to ineffective self-treatment. Regulatory failure here lies in not adhering to the professional scope of practice and the requirement for evidence-based knowledge. A further incorrect approach that prioritizes speed or convenience over anatomical accuracy, for instance, by making assumptions about TMJ structures based on common presentations, is also professionally unsound. This demonstrates a lack of diligence and a disregard for the intricate nature of anatomical variations and pathologies. Such an approach can lead to significant diagnostic errors and compromise patient safety, violating the ethical duty of care. The professional decision-making process for similar situations should involve 1. Actively recalling and applying precise anatomical knowledge of the TMJ, including its bony components, articular disc, and associated musculature and ligaments. 2. Consulting reliable anatomical resources or experienced colleagues when uncertainty arises. 3. Clearly and accurately communicating observations and information to the dentist, using precise anatomical terminology. 4. prioritizing patient safety and well-being by ensuring all actions are based on sound anatomical and clinical understanding. Question 17. Risk assessment procedures indicate a patient is experiencing sharp, localized pain when biting down on their lower left posterior quadrant. The patient describes the pain as feeling deep and sometimes throbbing. Based on your understanding of dental anatomy and physiology, which of the following is the most appropriate initial step for a certified dental assistant trademark, CDA, to take in assessing this situation? Option A. Ask the patient to describe the pain in more detail without performing any visual examination. Option B. Advise the patient that the pain is likely due to general gum sensitivity and recommend over-the-counter pain relievers. Option C. Immediately assume the patient has a cracked tooth and inform the dentist of this presumptive diagnosis. Option D. Visually inspect the lower left posterior quadrant, noting the condition of the teeth, gums, and surrounding tissues, and correlate the patient's description with potential anatomical structures involved. The correct answer is D. Visually inspect the lower left posterior quadrant, noting the condition of the teeth, gums, and surrounding tissues, and correlate the patient's description with potential anatomical structures involved. Explanation. Scenario analysis. This scenario presents a challenge because a dental assistant must accurately identify anatomical structures based on visual cues and patient reporting, which can be subjective. Misidentification can lead to incorrect treatment planning, patient discomfort, or even iatrogenic damage. The assistant's role is crucial in providing accurate information to the dentist, necessitating a strong understanding of dental anatomy and physiology. Correct approach analysis. The correct approach involves a systematic assessment of the patient's reported symptoms in conjunction with a visual examination of the oral cavity, specifically focusing on the described area. This aligns with the Certified Dental Assistant Trademark, CDA, scope of practice, which includes assisting in patient assessment and recording findings. The CDA is expected to possess a foundational knowledge of dental anatomy to correlate symptoms with specific tooth structures, their surrounding tissues, and their physiological functions. This approach prioritizes accurate observation and correlation, which are essential for effective dental care and patient safety, adhering to ethical principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach is to rely solely on the patient's description without a visual examination. This fails to incorporate objective clinical findings, which is a fundamental aspect of patient assessment and can lead to misdiagnosis. Ethically, this is a failure of due diligence. Another incorrect approach is to immediately assume a specific pathology without considering the broader anatomical context. This bypasses a thorough diagnostic process and could result in inappropriate interventions. This violates the principle of acting within one's scope of practice and potentially causing harm. A third incorrect approach is to dismiss the patient's complaint without adequate investigation. This demonstrates a lack of empathy and professional responsibility, potentially leading to delayed diagnosis and treatment, which is a breach of ethical care standards. Professional reasoning. Professionals should approach such situations by first actively listening to the patient's chief complaint. This is followed by a thorough visual and tactile examination of the affected area, correlating the patient's symptoms with known anatomical landmarks and physiological processes. Documentation of findings is critical. If uncertainty exists, consulting with the supervising dentist is paramount. This systematic, evidence-based approach ensures patient safety and adherence to professional standards. Question 18. The monitoring system demonstrates consistently elevated levels of airborne particulate matter in the operatory during aerosol-generating procedures. What is the most appropriate immediate next step for the dental assistant to take? Option A. Discuss the findings with a senior dental assistant to get their opinion on the best course of action. Option B. Initiate a formal risk assessment to identify the source of the elevated particulate matter and evaluate existing control measures. Option C. Document the readings and continue with scheduled procedures as usual. Option D. Immediately cease all aerosol-generating procedures until the issue is resolved. The correct answer is B. Initiate a formal risk assessment to identify the source of the elevated particulate matter and evaluate existing control measures. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a dental assistant to interpret data from a monitoring system and translate it into actionable steps for occupational safety and health. The challenge lies in accurately identifying the root cause of the elevated readings and implementing appropriate control measures without overreacting or underestimating the risk. A failure to properly assess and respond can lead to continued exposure to hazards, potential harm to staff, and non-compliance with regulatory standards. Correct approach analysis. The correct approach involves a systematic risk assessment process. This begins with identifying the hazard, elevated levels of a specific substance or condition, analyzing the risk by considering the likelihood of exposure and the potential severity of harm, and then evaluating the existing control measures. Based on this evaluation, further control measures are implemented or existing ones are improved. This aligns with the principles of occupational safety and health regulations, which mandate proactive identification and mitigation of workplace hazards. For a certified dental assistant, CDA, this means understanding the specific risks associated with dental procedures and materials, such as exposure to aerosols, chemicals, or radiation, and knowing how to respond when monitoring indicates a deviation from safe levels. This approach ensures that interventions are targeted, effective, and compliant with established safety protocols. Incorrect approach is analysis. Ignoring the readings is a direct violation of occupational safety and health principles and likely regulatory requirements. It demonstrates a failure to acknowledge potential hazards and a disregard for the well-being of oneself and colleagues. This approach creates an environment where risks are unmanaged, leading to potential health issues and legal repercussions for the practice. Implementing immediate, drastic changes without a proper assessment is inefficient and potentially disruptive. While it shows a willingness to act, it lacks the analytical rigor required to ensure the most effective and appropriate solution is chosen. This could lead to unnecessary costs, inconvenience, and may not even address the actual source of the elevated readings, thus failing to achieve the desired safety outcome. Consulting only a colleague without involving the designated safety officer or supervisor is a failure in the chain of command and communication protocols for safety issues. While peer consultation can be valuable, critical safety concerns require formal reporting and investigation through established channels to ensure proper documentation, resource allocation, and adherence to regulatory reporting requirements. This approach bypasses necessary oversight and can lead to inconsistent or inadequate responses. Professional reasoning. When faced with data from a monitoring system indicating a potential safety issue, a dental assistant should follow a structured decision-making process. First, understand the nature of the monitoring system and what it is designed to detect. Second, identify the specific reading and compare it to established safe limits or baseline levels. Third, initiate a preliminary assessment to identify potential sources of the elevated reading. Fourth, consult relevant safety protocols and guidelines. Fifth, report the findings and proposed initial actions to the appropriate supervisor or safety officer. Sixth, participate in a formal risk assessment if required, which may involve further investigation and the implementation of control measures. This systematic approach ensures that safety concerns are addressed effectively, efficiently, and in compliance with all applicable regulations. Question 19. Consider a scenario where, during a routine dental procedure, a dental assistant notices a visible speck of debris on a reusable dental instrument that has just been used intraorally. The assistant is concerned about potential cross-contamination. What is the most appropriate immediate action to take? Option A. Immediately remove the instrument from the patient's mouth and initiate the full reprocessing cycle for reusable instruments, including cleaning, disinfection, and sterilization. Option B. Rinse the instrument under tap water to remove the visible debris and then proceed with the dental procedure. Option C. Set the instrument aside to be reprocessed later, after the current patient's procedure is completed. Option D. Wipe the visible debris off the instrument with a surface disinfectant wipe and continue using it for the remainder of the procedure. The correct answer is A. Immediately remove the instrument from the patient's mouth and initiate the full reprocessing cycle for reusable instruments, including cleaning, disinfection, and sterilization. Explanation. Scenario analysis. This scenario presents a common but critical challenge in infection control within a dental setting. The core difficulty lies in balancing the immediate need for patient care with the absolute requirement for maintaining a sterile or clean field to prevent cross-contamination. The presence of a visible contaminant on a critical instrument, especially one intended for invasive procedures, immediately triggers a breach in standard infection control protocols. The professional challenge is to rectify this breach swiftly and correctly without compromising patient safety or the integrity of the sterilization process. This requires a thorough understanding of the principles of asepsis, instrument processing, and regulatory compliance. Correct approach analysis. The correct approach involves immediately removing the contaminated instrument from the patient's mouth, discarding it if it's single-use and contaminated, or initiating the full reprocessing cycle if it's reusable. This aligns directly with the principles of infection control as mandated by regulatory bodies such as the Centers for Disease Control and Prevention, CDC, guidelines for infection control in dental healthcare settings, which are foundational for the Certified Dental Assistant Trademark, CDA exam. Best professional practice dictates that any instrument that has been contaminated and is not immediately sterilized or is found to be contaminated prior to use must be reprocessed or discarded. This prevents the transmission of microorganisms to the patient, the dental team, and other patients. Ethically, this action upholds the duty of care to the patient and the commitment to maintaining a safe healthcare environment. Incorrect approach is analysis. One incorrect approach is to attempt to wipe the visible contaminant off the instrument with a surface disinfectant wipe and then continue using it. This is a significant regulatory and ethical failure. Surface disinfectants are not designed for cleaning critical instruments, and wiping alone is insufficient to remove all microorganisms, especially those embedded in crevices or lumens. This action directly violates the principles of proper cleaning and sterilization, increasing the risk of patient-to-patient transmission of pathogens, a direct contraindication of infection control standards. Another incorrect approach is to rinse the instrument under tap water and then proceed with the procedure. Rinsing is a step in cleaning. It is not a substitute for thorough mechanical cleaning and subsequent sterilization. Tap water alone will not remove all debris or kill microorganisms. This approach fails to meet the minimum requirements for instrument reprocessing and poses a substantial risk of infection transmission, violating fundamental infection control protocols. A third incorrect approach is to set the instrument aside to be reprocessed later, after completing the current patient's procedure. This is a critical failure in immediate risk management. The instrument, having been contaminated during the procedure, poses an immediate risk of cross-contamination if not handled according to protocol. Delaying reprocessing allows for potential microbial proliferation and increases the likelihood of errors in the subsequent reprocessing steps, thereby compromising patient safety and regulatory compliance. Professional reasoning. Professionals in dental assisting must adopt a decision-making process rooted in a hierarchy of safety and compliance. When faced with a potential breach in infection control, the immediate priority is to prevent harm. This involves a rapid assessment of the situation, identification of the specific breach, e.g., instrument contamination, and the application of established protocols. The decision-making framework should involve 1. Immediate containment of the risk, e.g., removing the instrument. 2. Application of the most stringent and appropriate protocol for the situation, e.g., full reprocessing or discarding. 3. Documentation of the incident if necessary. 4. Review of the incident to identify any systemic issues or training needs. This systematic approach ensures that patient safety remains paramount and that all actions are in alignment with regulatory requirements and ethical obligations. Question 20. The investigation demonstrates a potential lapse in the sterilization process for a set of critical dental instruments. The autoclave cycle completed, but the external indicator strip did not change to the expected color. The dental assistant is unsure if the instruments are safe for patient use. Which of the following actions represents the most appropriate risk assessment and response? Option A. Use the instruments as they are, as the autoclave cycle was completed and the risk is likely minimal. Option B. Immediately reprocess the instruments through a full sterilization cycle, ensuring all parameters are met and verifying all indicators. Option C. Disinfect the instruments thoroughly with a high-level disinfectant and then use them for patient care. Option D. Assume the indicator strip is faulty and proceed with using the instruments after a standard surface disinfection. Correct answer is B. Immediately reprocess the instruments through a full sterilization cycle, ensuring all parameters are met and verifying all indicators. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the dental assistant to critically evaluate a potential breach in sterilization protocols, which directly impacts patient safety and the integrity of the dental practice. The challenge lies in identifying the root cause of the potential issue and determining the most appropriate corrective action without compromising patient care or violating regulatory standards. A thorough risk assessment is paramount to prevent the transmission of infectious agents. Correct approach analysis. The correct approach involves a systematic risk assessment that prioritizes patient safety and adherence to established sterilization and disinfection protocols. This means immediately isolating the potentially compromised instruments, reviewing the sterilization cycle logs and equipment maintenance records, and consulting with the supervising dentist or office manager. This approach aligns with the fundamental principles of infection control mandated by regulatory bodies governing dental assisting, ensuring that all instruments are properly reprocessed before patient use. It reflects a proactive and responsible stance in maintaining a safe clinical environment. Incorrect approaches analysis. Continuing to use the instruments without further investigation is a severe regulatory and ethical failure. It directly violates infection control standards designed to prevent cross-contamination and the transmission of pathogens, putting patients at significant risk. This action demonstrates negligence and a disregard for patient well-being. Assuming the sterilization cycle was successful without verifying the indicators or logs is also a failure. While the cycle may have appeared to run, equipment malfunction or user error can lead to incomplete sterilization. Relying solely on the assumption of success without verification is a breach of due diligence and regulatory compliance. Disinfecting the instruments instead of re-sterilizing them is incorrect because disinfection is a lower level of microbial control than sterilization. While disinfection kills most microorganisms, it does not eliminate all forms, including bacterial spores. Sterilization is required for critical and semi-critical instruments to ensure they are free from all microbial life, a standard that cannot be met by disinfection alone for reusable instruments. This approach fails to meet the stringent requirements for instrument reprocessing. Professional reasoning. Professionals should approach such situations by first recognizing the potential for harm. The immediate priority is to prevent any further risk to patients. This involves a pause in clinical activity related to the potentially compromised instruments. Next, a systematic investigation should be initiated, involving a review of all relevant documentation and equipment. Collaboration with supervisors and adherence to established office protocols for handling such incidents are crucial. The decision-making process should always be guided by the principle of do no harm and strict compliance with regulatory guidelines for infection control.